everyone. My name is Antanesian. You can call me V. I know it's a mouthful. I'm a third-year resident from Norton Community Hospital and here to present a case about Viper insecticide toxicity, which caused another bradycardia. Okay. Viper insecticide is generally a insecticide used in gardening, so it's very common in around our area. So we had a 69-year-old male who came in for near syncope or slash syncope, kind of passed out, and he was having chest pain. The past medical history was notable for fatty liver slash NASH, but it wasn't diagnosed. It wasn't like biopsy was done and it was for sure NASH. Hyperlipidemia and gout. So he came with dizziness, passing out and having chest pain with bradycardia, heart rate around 30 to 60s. So the important thing is I'm in a small hospital. We don't have cardiology. So if I'm going to keep this patient, I have to make a decision at night if I'm going to keep this patient or not. There's no attending. There's no one else. So the ED calls the cardiology team, and the cardiology team looks at the EKG, is not impressed with it. It's a PAC. But what we see on the monitor is like the whole bunch of bradycardias, including first and second degree AB block that is changing every 2 seconds, let's say. So when I go evaluate the patient at that time did not have any symptoms, but came in with chest pain. But I see the EKG and the rhythm is varying every second, right? So I looked at basically when you're working on a bradycardia and you want to keep it in a hospital that is only observation, you want to see a reversible cause, such as medication or something that you can stop and the bradycardia will go away. So he doesn't need a pacemaker, basically. So he did not have any medications that would cause the bradycardia, no beta blockers or anything. There were no signs of ischemia. He was saying that during the past year, he had lost 40 pounds walking because his doctor said you have fatty liver, so you need to lose weight. So he was doing that. So what it took was a little bit of curiosity and asking for exposures. And as we asked for exposures, he said that he gardens and he uses this insecticide for his gardening. And at that time, I looked up the active ingredient in that insecticide, and it turned out to be cypermethrin. And there was reported cases of bradycardia with this insecticide. So cypermethrin is not only used in that insecticide, it's used in a whole bunch of insecticides because it's safe in humans because it gets clear through liver pretty fast. I guess the NASH here plays a role, maybe. So interesting case was that once I found that, I was able to prevent the patient being transferred because let's say if it's a non-reversible cause, what I have to do if I keep it there, if the patient stays bradycardiac or develops symptoms, you want to do a percutaneous pacing, and that's not a pleasant thing. And it's very nerve-wracking not having any specialist, and I do the percutaneous pacing in the hospital. So having found that and knowing that it's symptomatic management, poison control was consulted, and we just symptomatically managed the patient, and the bradycardia resolved by the morning, and patient was discharged. And 7-month follow-up, he did not have any bradycardia after stopping using the insecticide. Okay, so one interesting part is like getting the proper history and finding this to be able to keep the patient and not do any excessive studies and, cost-effective management. Another interesting thing is what was causing this bradycardia and the hypothesis of how the bradycardia happens. Basically in the literature, the hypothesis was that it affects the sodium channels, and that's how the bradycardia happens, sodium channels in the myocytes, right? But when I was looking at the case reported about this cypermethrin toxicity, there was a case reported in 2016 that it was from bed bugs. They were trying to kill the bed bugs and they got the bradycardia. So at that time, they just managed it symptomatically and it resolved. There was another case that the patient ingested it as a suicide attempt, and the bradycardia lasted 2 days, but during that hospital stay, they gave atropine to the patient. We know atropine works in the autonomic nervous system, and that's how it resolves the bradycardia. So now thinking about it, it could be channelopathy or it could be vagal nerve mediated. And cardiologists love to say it's vagal mediated. The bradycardia is vagal mediated. In even the case before this, the acyclovir one, the cardiologists were thinking, oh, it's vagal mediated. So upon further reviewing this vagal mediated, whether it's vagal mediated or not, there was few studies done in athletes to see what's causing bradycardia in athletes, right? We say increased vagal tone, but technically speaking, there is multiple studies showing that it's not vagal tone that is causing the bradycardia, because they have done this study in mice where we cut the vagus nerve after the bradycardia, and bradycardia did not resolve. And they separated the myocytes from the SA node. And at that time, the bradycardia did not resolve either. And that's why the new guidelines for sick sinus syndrome mentions about there's changes in the channels themselves rather than vagal nerve having it being the causative agent of the bradycardia. So my hypothesis would be, like, depending on the dosing, I think it could be vagal nerve or it could be channelopathy, because the sodium channels are present in all our nervous system and probably in the vagus nerve too. So depending on dosing, it could be affecting the vagus nerve or the myocytes itself. And as I discussed before, the case with bed bugs, it resolved pretty quick. Our case resolved pretty quick, but the one that was with ingestion, it took 48 hours. So depending on where is the causative agent, what part is the causing of the bradycardia, depending on that, it could be the vagus nerve or the channel being blocked. I think there could be a lot of studies done to find out exactly what the mechanism is, but that was my hypothesis. And I think when it comes to it, it's very important to point out that proper history taking comes first, because when you go to the ED and you're seeing so many patients, how often is it that you really go into the exposure and you find out something rare? And further into the case, as I discussed with the patient about this, insecticide can cause this bradycardia or the symptoms that he was having, he was saying, oh, 3 weeks ago, I was like dusting my garden and I felt the same thing. So he probably had the same thing happen at that time. So we were able to prevent the symptoms, and, he lived a happy life. That's all. Thank you for listening. Any questions? So great question. I remember it was 8 hours, I believe, but I'm not 100%. That's what I remember reading. Yeah. None of them talked about liver disease, because one of them was basically a toxicity. He drank a lot of it. The other one, I don't think they even mentioned how long was the exposure. It just was mentioning about they were trying to kill bed bugs. But when I look at how the cypermethrin causes the toxicity, it could be through ingestion, it could be from skin contact, it could be inhalation. And usually the symptoms you get is GI upset and neurologic symptoms such as seizure, which again talks about like sodium channels. It could be because of the nervous system, right? But is it just the nervous system, or is it dose dependent to be different channels at different doses? But that would be my hypothesis. It needs to be tested for it to be, proven.